Hi, everybody, and thanks so much for tuning into Deborah Kobylt Live today. On the phone with us from New York City is one of the top physicians there, family physicians, Dr. Thomas G. O'Brien II. And Dr. O'Brien wrote Medical Marijuana, Real Life Success Story. So please tune in for a lot of those people who are sort of don't quite understand the uses of medical marijuana. Dr. O'Brien is going to explain all this to us. So thank you so much for joining us.
Hey, thank you for allowing me to be part of your program.
Yeah, and I love that accent. We were doing we were laughing a little bit about that on the phone yesterday, right? We were both getting into it, thick as can be, our New York
There you
accents.
go.
There you go. And what do they call you,
How
Doc?
you doing there?
Hey, how you doing, Dr. Tom? Isn't that what they call you?
There you go.
There you go.
Yeah, I go by Dr. Tommy O or Dr. Tom or Dr. Tommy, Dr. O or whatever you feel comfortable with.
There you go. All right, Dr. Tommy. So you're a family physician and clinical nutritionist, and you are New York State certified as a medical marijuana physician. And I guess I'm just going to get right into it. What does that mean? Like, what is
Oh, yeah.
medical marijuana? Because a lot of people are still very suspect. They're like, wait a minute, I'm going to go get high? So what is it?
Right. Well, that's a wonderful question. The medical marijuana is marijuana. You hear the term recreational versus medical marijuana. It's the same plant. The difference is we use a specific ratio with a very low THC compared to a recreational, and that's how we differentiate. Now, which will eventually explain what the THC and CBD are. But we differentiate recreational versus medicinal or medical based on the percentage of THC that's in the specific ratio oil that we use.
Well, to break it down a little bit, because in your book it says there are, in one marijuana plant, there are 400 different chemicals in that plant. 70 of them have been shown to have medicinal properties. The two main chemicals used for medicinal purposes are THC and CBD, right? So very
Yes.
interesting. A lot of people don't realize that there are 400 different chemicals and 70 of them used for medicinal. I think that's fantastic.
Yes.
So,
Exactly. What that's what we know. With today's technology, there may be more chemicals that have medicinal properties, but we know that at least 70 out of the 400 have medicinal properties.
so just so I know, THC does or does not have the capability to make you feel high?
Yes, that's based on receptors. So what we're talking about, and your listeners will hear THC and CBD. THC is tetrahydrocannabinol, and CBD is cannabidiol. They're both cannabinol, and they're chemicals that come from the cannabis plant.
Mm-hmm.
The THC has CB1 receptors, and those receptors are found in the central nervous system, and so it's associated with the psychoactive properties of what we call the stoner's high, anxiety, paranoia, increased stimulate appetite, the munchies that the people know that term, as well as sedation. CBD, on the other hand, cannabidiol has CB2 receptors. They are not located in the central nervous system, so there's no high or psychoactive properties associated with CBD.
Interesting. So I'm in pain. I come to see you, and you start to talk to me about medical marijuana and how it can help me. What's the first thing that you will do for me?
Sure. Well, the first thing I do is I do a thorough history and physical, and then we, together as a team, we discuss the proper approach. What's the main focus of the individual? What type of pain? So we have to break it down because there's different receptors, so my approach will be different. Once we define what the specific medical condition is that we need to address, and then together as a team, and I like to work as a team, we'll pick. I will pick the appropriate ratio that will address the issues.
What now? There's three different ways that you treat people, right? You've got oils. You have you inhale. Why don't you explain that to me? You'll do a better job than I will.
Sure. That's good. So we have an understanding that it's all the same. It's oil from the plant in New York, and most states do not have what we call the bud, or the leaf, or what we know as a joint. So we take the plant and they grind it down. I'm talking about when I say we, I'm really referencing the dispensaries, and they'll grind it down and extract out the chemicals what I just spoke about, that addressed the CBD and THC, and in the oil form, because all plants have oils, and we're extracting out the chemicals that have the medicinal properties. And then in New York State, we have 3 ratios, which I'll quickly define. We have the first ratio, which is high CBD, low THC, and the second ratio where THC and CBD are equal, and the third ratio we have THC is higher or stronger than the CBD, and we have a delivery system, and that's what you were questioning. We have 3 delivery systems. We have what's called a vapor. Onset of action is about 90 seconds, and it lasts 3 to 4 hours. Then we have an oral form. There is a tincture or sublingual drops. It's the same exact oil, but just in a liquid versus the liquid being heated to turn into a vapor, steam. The oil, you release and it goes below your tongue. You hold for as long as you can, then you swallow the rest. Onset of action is about 20 minutes, and it lasts about 3 to 4 hours, depending on your metabolism. The third delivery system is oral, but we'll say capsule. And onset of action is about an hour and a half, and it lasts between 4 and 6 hours. It's the same exact oil. It's just packaged differently based on the delivery system. And there's pros and cons for each, which I already discussed, the onset and duration, but then cost is a factor as well.
And you also have topical oils too, right, that you rub on the body.
Yes, some states will have a topical. New York, we were approved a year ago for a topical, and it took a year for the dispensary to finally formulate a lotion. They have a lotion. We were approved for an edible, like a gummy, but they haven't released that. Now, some states will allow edibles. We do not have one that's ready, available for purchase, but that's part of being oral.
We have
it's
them
the same
here.
Delivery system.
Out in California, we've got them here. We've got the edibles, we have the lotions and the oils, and just about anything else that you need to put in or on your body when relating to a marijuana plant, I will tell you. You know, with varying degrees of success, I will tell you. Now, in your book, you talked about a few chapters that I'm actually going to point out, which I thought were very interesting. We talked about this. Irritable bowel disease. Tell me how you can help cure irritable bowel disease with the properties in marijuana.
Right. Well, that's a good term. You just used the term, and I wanted to address that, and we'll get right in. You said cure. In medicine, there's no such thing as cure, and that's why people don't understand. We use the term treatment. Cure means it will never, ever come back, so we prefer to say treatment. So an individual who has irritable bowel disease versus irritable bowel syndrome, the difference is we defined by diagnosing the patient has irritable bowel disease, and that would be either Crohn's or ulcerative colitis. Both of those diseases, they have a lot of inflammation, cramping, and then their bowel movements, it could go from one extreme to the next where they're constipated, and soon after they can have a very loose stool. A lot of times it's based on stress and if they're nervous, also, of course, of what they eat, so they have to be very careful. Some individuals are a little bit more sensitive, especially like with dairy. So what I would do is I would ask my patient, what's the most important symptom you want to address? Is it the inflammation? Is it cramping, or pain? Sometimes the patient will say, well, I don't have any pain, but I just have the very loose stools. And so with a lot of inflammation and bloating, so what I'll do is I will use a high CBD product, like in a high CBD, low THC, because I'm not looking to address the pain portion with the THC. So I'm looking to calm down the GI tract, that spasm, what we call peristalsis. And my patients do very well with that. To about a month of being on the CBD THC combination, they'll start to see changes in their bowel movements. You'll see their stools will be more formed, and they'll feel more comfortable. If they come in with pain associated with the cramping, I will typically use a 1-to-1 ratio, so we have all the benefits of the anti-inflammatory of CBD, but now I'm starting to introduce THC a little bit higher so we can go after the sharper pain that's associated with the cramping.
You were telling
and they'll
me
get the same results.
you were telling me on the phone also that you had a patient who was really struggling, and how this person was able to sort of get their life back. Can you tell our audience about that as well?
Yes, absolutely. This individual came in, they had the classical symptoms of Crohn's disease and irritable bowel. So we addressed the issue, and I said we're going to start with this ratio. I chose the ratio that would best benefit, and after the first month, the patient started seeing better formed stools. And during the history and physical, the individual said that their social life, they really didn't have a social life because it was very embarrassing, and every time they'd go out on a date, that they would have to excuse themselves because they would get very nervous, and because of the date, the situation itself, but the fact that the person has this condition just compounded it, and so they would have to excuse themselves and go to the restroom to purge. After a month, we started seeing improvement, and after a couple months, the patient started putting weight on. After about a year or so, the patient started dating. Felt comfortable to go out and start dating, and after 2.5 years, the patient got engaged, and just recently, this individual got married. So
Wow.
It really was a lot. Yes, life-changing for this individual.
Wow. So is this a male or female?
To protect my patients, I have HIPAA, so I like to keep it so it's
All right, fair.
so we're not going over male female.
It's fair to say that this particular patient had a pretty lousy dating life because of what was going on with his or her bowels, and frankly came to you, and after a certain period of time and treatment, this person is now getting married. So congratulations.
That's correct.
That is a great story. Yep. I have to tell you, when you told me yesterday, I thought, that's a good one. I mean,
yes,
that's a great story. How you really cured someone of their horrifying irritable bowel and embarrassing irritable bowel. Okay, let's talk about back pain. Let's talk about that. Somebody comes to you, they have back pain. What do you do?
Yep. Again, it depends on the type of back pain. Pain's pain, we understand that, but what is the cause? And that's what I'm really referring to. Is it post-surgical, or is it due to muscle spasms? Is there degenerative disc disease where they have a bulging disc or a herniated disc? And after we do a thorough history and physical, and I'll review the x-rays, typically, if they have what's called a radiculopathy, and that's where the pain begins in the lower back, like lumbar radiculopathy, and the pain radiates down the back of their thigh and maybe possibly down into their sole of their foot,
Wow.
I would choose a 1-to-1 ratio, so I have the benefits of the CBD as well as THC, so we're getting a lot of anti-inflammatory properties as well as sharp pain reduction, and that's what the THC does. A lot of my patients do very well, and then what I will put these individuals that don't sleep well, I'll put them on a high THC, low CBD ratio for bedtime, so they get a good night's sleep, block the pain, and they wake up the following morning feeling refreshed. And a lot of times they will state that I feel a little bit more flexible. I get great results with that. It's not perfect, but I get really good results with it.
So are patients also sent home with a prescription so they can also take this and do this on their own? Or do they, in your state, in New York State, they have to always come to you for relief?
Yes. Well, New York State is probably one of the most stringent, very, very strict. So we have what we call you must have a qualifying medical condition, and before a patient enters my office, we screen them out so we're not wasting time.
Right.
So anyone who walks in my door, I already know they qualify because we screen them out, and then I do a history and physical, and then I qualify them, and then I register them, and after an hour, I really spend an hour with my patients. I take my time. This is not quick. I want to educate them. I teach them about how the medical marijuana works in their body, as well as how it, let's say for this instance, blocking pain, how it works based on receptors. When they're done after an hour, I give them a temporary ID plus their prescription, and then they go to a local dispensary, and we have about 8 dispensaries in New York now. We've added an additional 3 within the last 2 months. And with the prescription, they go there and then they're able to pick up a month's supply. And they start, and we do a 1-month follow-up. I have my patients have access to me 24 hours, so if they need me, they can shoot me an email or call my call service, and I'll answer their questions. Or they'll come in. We have a face-to-face, a 1-month follow-up face-to-face. And if my patients give me the thumbs up and I say I feel really good and this really made a difference, because you're going to know right away.
Right.
Patients, I tell them right off the bat, I said, you're going to know. It doesn't have to build up. It's either it works or it doesn't. Maybe I can tweak it a little bit, but it works or it doesn't. And if it doesn't, I just say this is just not for you. But we'll know right away. And my patients, call up or to send me an email and they feel wonderful and they're happy. And if I nailed it, I might have to tweak it a little bit, but I try to nail it right away and choosing the proper ratio. And then I just say I'll see you every 4 months, and they come in for 4 months for a new prescription.
That's fantastic. So let me just talk a little bit about a little more that you discuss in your book. Again, medical marijuana, real life success stories. You talk about PTSD. Can you briefly tell us a little bit about that and how you treat some of your patients? I know that you've worked with first responders from 9/11. Tell me a little bit about that.
Yes, also my military brothers and sisters, my military family, we'll say global, they'll come in with, depending on the exposure, post-traumatic, as it is in the name post-traumatic stress disorder. You've been exposed to some sort of an event which you have memory, and a memory in your brain of the traumatic event, and when there is some sort of trigger, it brings that memory back, and you have the increased heart rate and whatever, however your body responds to that particular trigger. So I have individuals that come into me, and I ask them what is the trigger and what are the symptoms that are associated with the post-traumatic. Sometimes there is pain that's associated with it, because if they were in the military and they have phantom pain,
right,
they lost a limb, or even if they were, let's say, a fireman, a policeman, and they were in a line of duty and they got injured and they lost a limb, or they were shot as well, they could, something stimulates those memory cells, and they'll experience some sort of pain. It could be emotional pain, or it could be actually physical pain. And so I will choose a ratio that would help based on whatever that emotional or physical pain will be. With it, let's say, for example, the emotional pain, I will use a high CBD, very low THC, because I'm looking to keep the individual very, very focused and relaxed. CBD has a calming effect. I call it a well-being, so you're very balanced and you're very focused. Patients experience, they when they describe the feeling, they're like, well, I don't feel high. I said, well, you're not supposed to.
Right.
But I do feel very focused. I feel almost energized. I said, that's exactly what CBD will do. It's not a stimulant, but it keeps you very focused and you feel energized. Individuals who suffer from a lot of behavioral disorders have a tendency to wander in their thoughts. CBD will keep you focused so you're not wandering. Like if you have anxiety, you're wandering. You just can't focus.
Right.
CBD will keep you. It'll keep you very balanced.
And this would be in like a pill form or under the tongue, that sort of thing?
Yeah, it could be the capsule, like the delivery systems, as we stated earlier. It could be the capsule, it could be sublingual drops, or it could be a vapor, whatever they feel comfortable with. Here would be a good question. Well, how do you choose a delivery system? I said, well, it's up to the patient. The patient makes that decision. I may guide them because one may be better than the next. but it's really up to the comfort of the patient, whatever they're familiar with. Like if someone's a smoker or a former smoker, they might feel more comfortable with using a vapor. If someone's like, listen, I've never smoked, I don't want to put anything in my lungs,
Right.
typically they will go with a sublingual drops. I have patients that are in their 8th and 9th decade. I think my oldest patient is 96. They do not have the skill set with the fine motor skills to be able to do a vapor or sublingual drop, so it's easier for them to do a capsule, or they have their caregiver give them the capsule. So that, that we as a team, I always say we, will determine what's going to be the best ratio for their particular condition, as well as the delivery system, what's going to get the best outcome from them.
Clearly, this is a big business in your state and others who have legalized this. And as a family physician, you really 100% believe that this is the best way, the most effective way to help so many of your patients. How many years now have you been working with people through marijuana for medicinal purposes?
Right. Yeah. I'm a believer. That's why I'm doing this.
Yeah.
I am in business for 4.5 years. In July 2014, New York State passed the Compassionate Care Act. I was certified soon after that, where I could become a certified physician to prescribe medical cannabis, and it went into effect January 2015. So my doors were open January 2015. I'm one of the first in the state of New York, and I'm the first in New York City to open the doors to treat patients with medical cannabis.
Fantastic. And for people, I'm going to implore them to please pick up this book. It's a terrific read. It's a very easy read, and it really explains to everyone what medical marijuana is. It's not like going and buying, marijuana on a street corner and smoking a joint. This is not what that is. People just still don't quite understand the value of medical marijuana. And in your book, Real Life Success Stories, you talk about that, which I love. You talk about Parkinson's disease, traumatic brain injuries, fibromyalgia, also dying with dignity. Very terrific book. I really enjoyed. I enjoyed this read. It taught me a lot. In fact, some of my ailments, I'm starting to think that this could be a way for me to go as well. If people want to get in touch with you, how do they do that?
Yes, well, they can, if they want to learn more about the program in New York, or just in general, they can go to my website at www.doctommy.com, and I have drop-down menu, and I'll educate you on what we were discussing. They can always call my office at 212-201-9122, so they have an understanding that if you do not live in New York, I cannot treat you, because I would have to be licensed in that particular state. I'm only licensed in New York, but you can always ask some questions. I just cannot diagnose and treat. That's why in the book itself I have disclaimers, so you have an understanding that this is educational, and I had to protect my patients with, for HIPAA regulations, so I didn't have male, female, or any descriptive terms to keep it as neutral, but to also maintain that emotional component. This book was written as an easy read, as you just explained, and I wanted the readers to experience what my patients experience, and actually as you're reading, you're doing a walkthrough with the patient, with the questions, and how I came to my conclusion, and how we made the decisions together, and how we chose the ratios, and then the follow-up care. So you really get a sense of what the patient was going through.
Okay, very good. Very, very interesting. I really enjoyed this. But really quickly, before I let you go, how many states have legalized the use of marijuana for medical and medicinal purposes total?
I think, oh boy, I'm not exactly sure because it changes. 23? I'm not sure. Because I focus on New York, so I knew California was in the 1990s, so it's I'm gonna say probably in the 20s, but that's about right.
Okay. Very good. Wonderful to speak to you. I appreciate you taking the time to come on our show. Medical Marijuana, Real Life Success Stories. Please, everyone, pick up this book. It's terrific, easy to read, and you'll understand the uses by the time you finish this. So, Dr. Thomas G. O'Brien II, thanks for taking the time. We look forward to talking to you again. And everyone, thank you for being on for listening and watching our show. We're on Facebook and YouTube, Instagram, Twitter, and if you listen to your podcasts, Apple Podcasts, and of course the iHeartRadio app, Deborah Kobylt Live. And we will see you next time. Bye-bye.